Hi guys, I couldn't finish the recording yesterday because I wanted to go to the gym. I had a class. So I was in a rush. I didn't finish, but the worst part is I went there and they didn't let me in because I was like 5 minutes late. Um, yeah, it was my fault. I know that, but I couldn't finish the recording. I couldn't do the workout, so I was just a bit pissed. But yeah, so that's why I just changed my outfit. So back to the topic, section five. Section five is very important. There are gonna be a lot of questions in your test and also quiz because this is all about detrimental impact of drugs. Don't do drugs, right? So we have two of them that are just so bad for the health of baby. Number one is heroin, and number two is cocaine. So the first one can often cause preterm babies. It can just make baby more susceptible to medical condition, and it can cause SIDS. What is SIDS? SIDS. It is sudden infant disease syndrome. It is very important. We're going to use that a lot. And this is a hot topic these days in developmental psychology because we all want to just monitor baby's health and just make sure that we have a healthy creature, right? Drug number two is cocaine. It is very familiar to almost everybody, not just using them, but we heard about this. It can also cause preterm. It can cause low birth weight. It can cause high mortality rates, and it can just increase the likelihood of having cancer and also SIDS. Don't do drugs, okay? Another one is alcohol. Alcohol is not bad, it's good, but it's not good. It's not good for pregnant ladies. It can cause mental retardation and it can cause FAS. We already talked about this, FAS or fetal alcohol syndrome. It is bad, it's not good, but it has some criteria and signs. For example, the baby gonna have facial malformation. It can have, the baby can have heart disease, behavioral problems, and learning disabilities. You can see the face is different. But yeah, more teratogens. So even prescription drugs that can be teratogens, they can cause malformation, they can cause mental retardation and other side effects, even death. So, I mean, for every drug, if you would just go to the doctor or just even the box, you can see that it's just saying that, hey, if you are pregnant, don't use this drug. I would say that majority of drugs are like that. But if you would just consult with your doctor and just make sure that, okay, this kind of ointment, yes, even ointment that I'm gonna use wouldn't impact my baby, it would be helpful because the doctor should approve that. And you as a mom always should just avoid taking any sort of drugs unless it is necessary. There might be some environmental hazards like pollution in the air, heavy metals, auto exhaust, and even painting on the wall. They can cause a lot of negative influence on baby and cause miscarriages. They can cause neurobiological problem and mental retardation. Infectious disease, they're also important. Before getting pregnant, both parents, they should go to the doctor and just make sure there is no HIV, there is no STD, and any sort of infectious disease, because it can cause heart, it can cause brain structure and bone structure as well. Maternal health, it is very important, especially these days. It's everybody has a lot of stress. And even providing food and good nutrition is not available for everyone. I know that government should just consider helping to even low socioeconomic status families, but parents who try to get pregnant, they have to just make sure the level of stress is just pretty much low, and the nutrition it just has quality. and also quantity. For example, it has vitamins, it has mineral, it has good amount of like different ingredient like proteins and anything that is necessary for the baby. Stress is also very important. Like high level of stress can impact blood flow and the level of oxygen that the feed is gonna take. It can increase like low level of oxygen for the baby and high level of stress for mom. It can increase the likelihood of low birth weight again and preterm birth. So just not having a stress is necessary for like moms. I know it's just so hard to avoid the stress, but they should consider that. They can just practice different techniques that can just help them to elevate the level of mental health in themselves. For example, doing yoga, doing meditation can be helpful, and just manage their stress level. So prenatal care, we already talked about that. It is very important. It can be nutrition and diet. It can be exercise. It can be prenatal screening and avoiding any sort of teratogens. Visiting doctor is also important. For example, until like the quantity of visiting doctor gonna change from months to months and even from week to week. For example, until 28 weeks, the visit gonna be once or twice in a month. But like it's gonna be more and more until the end. For example, by the end of the pregnancy, they like mom, she has to visit the doctor every week, if no more. Seriously, like it is very important. Just doctor would just monitor every possible situation. I know that SCS and race can be factors in receiving adequate prenatal care. Because I mean, some families they cannot afford seeing doctor like every week. They don't have a good insurance. They don't have like a good quality of nutrition around. So again, this is like something about governments that should provide that kind of facility for parents from low STS situation and a specific race.